Have you ever wondered why, even after eating healthy and taking your morning walks, your energy still feels lower, your steps slower, and your drive, not just for life, but for love, seems to fade? Is it just aging, or could something quiet be working against you right now? Today, we're opening a conversation that's long overdue about a small vitamin that carries a big impact. A vitamin you've probably overlooked, yet it may hold the key to improving two things that deeply affect a man's life after 60: your circulation and your sexual health. We're talking about vitamin D3. Now, most people think vitamin D3 is just about bones or the immune system. And yes, those are important. But today, we're going deeper. We'll explore how this one nutrient could be quietly supporting the very blood vessels that fuel your body, especially the parts of it that make you feel like you. What exactly is vitamin D3? In simple terms, it's the sunshine vitamin, produced by your skin when exposed to sunlight. It plays many roles in the body, including helping with calcium absorption and supporting healthy cell function. But what most men over 60 don't know is that low vitamin D3 levels are common, and they may silently affect your performance, your energy, and even your sense of self. By the end of this video, you'll understand how vitamin D3 helps your blood vessels function better, how it supports healthy sexual function, and what you can do today to make sure you're getting enough of it safely. So, if you care about aging well, staying confident, and taking control of your health, this is a topic you can't afford to skip. If this resonates with you, go ahead and hit the like button, leave a comment, and don't forget to subscribe to our channel. This is your space to learn, grow, and reclaim your vitality. Let's continue. Now let's dig into the first core benefit: blood circulation. Because the truth is, without proper circulation, everything slows down. Your movement, your energy, your recovery, and yes, even your erections. As we age, our blood vessels naturally lose some flexibility. Think of them like rubber hoses that slowly harden. This affects how well blood can flow to key areas, especially to your lower body and reproductive organs. But here's where vitamin D3 comes in. Vitamin D3 plays an important role in supporting vascular health. It helps the body absorb calcium properly and may influence how blood vessels dilate and contract. In simpler words, it helps your blood move more freely, where and when it needs to. Many men over 60 face circulation issues without even realizing it. That tingling in your legs when you sit too long, that cold feeling in your feet, that shortness of breath climbing the stairs. These aren't just normal aging symptoms. They could be signs your circulation needs help. Emerging research suggests that vitamin D3 may help reduce stiffness in the arteries and promote better blood flow. In men, this is especially relevant for areas like the pelvis and groin, where strong circulation is key for maintaining sexual function. Let's say this another way. If blood can't reach the parts that need it, those parts stop working like they should. And here's the twist. Many men are deficient in vitamin D3, especially those who don't get much sun, have darker skin, or live in northern climates. Even if you take care of your health, this vitamin may still be missing from your routine. But there's hope. By ensuring you have healthy levels of vitamin D3, you may not only support your heart and arteries, but also improve how your body responds when intimacy matters. Because good circulation isn't just about staying alive, it's about feeling alive. And that's why this simple, often ignored vitamin is becoming a topic of real interest for urologists, heart specialists, and aging experts alike. In the next part of our video, we'll dive deeper into the connection between vitamin D3 and male sexual health. What's real, what's rumor, and what you can do starting today. Now that we've looked at how vitamin D3 helps improve circulation, let's talk about something that many men over 60 quietly struggle with, but often feel too embarrassed to bring up: sexual health. If you've noticed a drop in desire, if your erections aren't as strong or as reliable, or if you just feel like your body isn't responding the way it used to, it's not just in your head, and it's not a sign that you're broken. It may be your body's way of signaling an internal imbalance. Here's where vitamin D3 enters the picture again. Your sexual health depends on multiple factors: hormones, nerves, blood flow, emotional well-being, and yes, even vitamin levels. In recent years, doctors have started looking at how low vitamin D3 levels might be quietly affecting men's sexual performance. and the results are eye-opening. Several studies now suggest that men with low vitamin D3 may be more likely to experience reduced libido, lower desire, difficulty achieving or maintaining erections, lower testosterone levels, and even overall fatigue that affects intimacy. Think of vitamin D3 like a support beam. It doesn't directly cause desire or erections, but without it, the whole structure becomes unstable. Your blood vessels don't respond as well. Your hormones may dip. Your energy doesn't show up when you need it most. Everything starts to feel off. One of the key reasons? Vitamin D3 may help regulate testosterone, the hormone that fuels male vitality. While it's not a replacement for hormone therapy, it may provide a natural support system that helps your body stay in balance, especially when paired with healthy sleep, good nutrition, and regular movement. And here's something else. Good sexual health is about confidence, knowing your body still works, and feeling proud of what you can offer in your relationship. When that's shaken, it affects more than your bedroom. It touches your mood, your connection, even how you see yourself. This is why taking care of your vitamin D3 levels isn't just about avoiding deficiency. It's about investing in your self-worth as a man. It's about protecting your ability to connect, to enjoy, and to express love without shame or hesitation. And the best part? It's something you can start working on right now. No expensive treatments, no complicated routines, just awareness, consistency, and the right support. In the next part, we'll show you exactly how to supplement vitamin D3 safely and effectively, so you can give your body the boost it needs, without guesswork and without risk. Because aging doesn't mean you have to slow down. Not when knowledge and one small vitamin can make a real difference. By now, you understand how vitamin D3 plays a powerful role in improving circulation and supporting sexual health. But that knowledge only becomes valuable when you put it into action. So let's answer the big question. How do you take vitamin D3 safely and effectively? First, let's start with the basics. Vitamin D3 is a fat-soluble vitamin, which means your body stores it, and getting too little or too much can both create problems. The key here is balance. So how much do you really need? For most adults over 60, health experts generally recommend 800 to 2000 IU per day, depending on individual needs, health conditions, and sun exposure. But here's something many people don't realize. As you age, your skin becomes less efficient at producing vitamin D3 from sunlight. That means even if you spend time outdoors, you still might not be getting enough. That's why supplementation, whether through diet or pills, can make a big difference. Let's break down the 3 best sources of vitamin D3. Sunlight. The most natural way to produce vitamin D3 is through sunlight. Just 10-30 minutes of midday sun on your skin a few times a week may help, but that depends on your location, skin tone, and season. Plus, many older adults avoid direct sun due to skin sensitivity, medications, or concerns about skin cancer, so sunlight alone may not be enough. Food sources. You can get vitamin D3 from certain foods like fatty fish, egg yolks, liver, and fortified products like milk or cereal. However, the average diet of older adults doesn't always include enough of these to meet daily needs, especially if you're avoiding cholesterol or have dietary restrictions. Supplements. Vitamin D3 supplements come in many forms: soft gels, tablets, liquids, even chewables. They're affordable, widely available, and easy to take. For many men over 60, a daily supplement is the simplest and most reliable way to keep levels in check. Now here's a very important note. Before starting any new supplement, it's best to talk to your doctor, especially if you have health conditions like kidney problems, take multiple medications, or are already using other vitamins. Too much vitamin D3 over time can lead to calcium buildup in your body, which might harm your heart or kidneys. So while it's safe when taken correctly, overdoing it can backfire. Most doctors will recommend a simple blood test to check your current vitamin D levels. This helps personalize your dosage and avoids the guesswork. And here's one more pro tip. Because vitamin D3 is fat-soluble, it's best absorbed when taken with a meal that contains healthy fats, like avocado, nuts, or olive oil. Taking it on an empty stomach? That might mean your body doesn't get the full benefit. To make it easy, think of vitamin D3 like brushing your teeth. It's not about doing it once. It's about making it a part of your routine, something simple, regular, and essential. So, what can you do starting today? Talk to your doctor about checking your vitamin D levels. Choose a high-quality supplement that's easy to take daily. Pair it with a balanced meal that includes healthy fats. Stay consistent and give it a few weeks to feel the difference. This isn't about chasing a miracle, it's about rebuilding your foundation. And remember, even a small daily habit, done with intention, can have a big impact on how you feel, how you move, and how confident you are in your relationships. In the next section, we'll explore other lifestyle changes that work hand in hand with vitamin D3. So far, we've explored how vitamin D3 can make a real difference in circulation and sexual health. But sexual wellness isn't built on one vitamin alone. It's a combination of many pieces, physical, hormonal, emotional, and lifestyle-driven, that come together to shape how you feel, respond, and connect as a man over 60. Let's look at some of the most important factors that may be affecting your sexual health right now, sometimes quietly, sometimes more obviously. 1. Natural aging and hormonal changes. One of the most common and least talked about shifts after 60 is the gradual drop in testosterone. This hormone plays a key role in sex drive, erections, energy, and even mood. It doesn't crash overnight, but slowly decreases over time. For many men, this creates subtle changes: less interest in sex, lower confidence, slower recovery, and a reduced sense of physical presence. These changes are natural, but they're not something you have to suffer in silence. Low testosterone can be evaluated through a simple blood test, and depending on your situation, your doctor may suggest lifestyle changes, supplements, or medical therapies to support your levels. 2. Circulatory and heart health conditions. As we mentioned earlier, blood flow is critical for sexual performance. But men over 60 often face conditions like high blood pressure, arterial plaque, or heart disease, all of which restrict circulation to the body's extremities, including the pelvic area. Erectile issues are often the first sign of a circulation problem, not a bedroom problem. That's why taking care of your heart, by walking daily, eating smart, reducing salt, and managing stress, also protects your sexual function. What's good for your heart is good for your penis, and that's a fact. 3. Psychological and emotional health. You could have perfect blood flow and strong hormone levels, and still feel disconnected from intimacy. Why? Because stress, anxiety, and emotional distance can be just as powerful as physical issues. After 60, many men carry silent burdens: worries about health, money, loss of independence, or relationship strain. These emotions can create a mental block that holds you back in the bedroom. Feeling anxious about performance is one of the most common causes of temporary sexual dysfunction. The key is to recognize that mental health and sexual health are deeply connected. Talking to your partner, joining a support group, or even speaking with a counselor can unlock more than just emotional relief. It can reignite closeness and confidence. 4. Diet, sleep, and lifestyle habits. What you eat, how well you sleep, and whether you move your body each day, these all matter. Diets high in sugar, alcohol, or processed foods can sap your energy, increase belly fat, and mess with your hormones. Poor sleep disrupts testosterone production and mood. Sedentary habits lead to weight gain and poor circulation. But here's the good news. Small changes go a long way. A 20-minute walk, more leafy greens, cutting down on late-night snacks, or getting 7 hours of sleep, these are simple actions with powerful impact. Sexual health doesn't require perfection. It requires consistency. 5. Medications you may be taking. Many older men are on medications for blood pressure, depression, prostate issues, or cholesterol. Some of these drugs have side effects that impact libido or performance. You may not even realize the link. That's why it's important to review your prescriptions with your doctor, especially if you've noticed recent changes in sexual function. Sometimes a small adjustment in dosage, or switching to a different medication, can restore your energy and drive. Putting it all together, sexual health after 60 is not about returning to how you felt at 25. It's about honoring where your body is now and giving it the support it needs to keep working, feeling, and loving at its best. It's about understanding that sexual well-being is part of your whole health, not separate from it. And it's about taking action, not just hoping things will fix themselves, The right mindset, the right nutrients like vitamin D3, and the right daily choices can give you back what you thought was gone. In the next and final part, we'll bring everything together, a simple, actionable summary, and a powerful reminder that it's never too late to feel alive, strong, and connected again. So, what have we really uncovered today? We've taken a journey through a topic that many men avoid, yet quietly wonder about. Why does my body feel different? Where did my energy go? Why is intimacy more difficult now? And along the way, we learned something powerful. Sometimes the missing piece isn't something dramatic. It's something simple, something silent. Like vitamin D3, a nutrient your body needs every day, but one that quietly slips away with age, lifestyle, and time indoors. We saw how vitamin D3 supports stronger circulation by helping blood vessels stay flexible and responsive, healthier sexual function by influencing hormones and blood flow where it matters, overall confidence by giving you more energy, clarity, and physical readiness. But we also learned this. Vitamin D3 alone is not the full answer. It's part of a bigger picture, one that includes movement, nutrition, sleep, communication, and self-awareness. Because sexual health after 60 isn't just about what's happening below the belt. It's about how you show up in your body, how you treat yourself, how you speak to your own worth. So here's what we want you to remember. You're not losing your vitality. You're being invited to rebuild it, smarter, slower, stronger. And it starts with one step. Ask your doctor to check your vitamin D levels. Add more nutrient-rich foods to your meals. Choose a supplement that works for your routine. Move your body a little more each day. Sleep, breathe, and talk openly with your partner. Stay curious about what's possible for your health even now. Aging does bring change, but it doesn't have to mean decline. The truth is, many men feel more powerful, more present, and more in control in their 60s and 70s than they ever did in their 30s. Once they start listening to their bodies and giving them the care they've always deserved. And that's what this channel is here for. Not to shame you, not to scare you, but to remind you, you can age with strength, with clarity, and with confidence in every part of your life. Final call to action. If this video helped you see something differently, let us know in the comments below. What part resonated with you most? What changes are you ready to make? Tap like if you found value here. Drop a comment with the word vitality if you're ready to take control of your health again. And make sure to subscribe because we're just getting started. This is your body, your story, your second chapter. Let's make it the strongest one yet.